Hi everybody, today I wanted to talk about a commonly asked question that I get about neurofeedback versus talk therapy. So let's start with the basics. We're going to use an example of general anxiety, not trauma specific, just anxiety. So talk therapy, and I'm talking about just kind of standard talk therapy, not the more experiential types, because talk therapy is a very broad term. So not including things like EMDR or somatic experiencing, things that are really kind of what you might think as CBT, DBT, or just general kind of processing therapy is very relationship based. And that's a very important component. Establishing that unconditional positive regard, as Roger taught us, establishing that foundational relationship of trust, empathy, respect, caring, those are essential and very important, especially if someone doesn't have that in their life outside of counseling. But that is not unique to talk therapy. That can also be established within the context of a neurofeedback relationship, depending on, if it's a clinician or a technician, but a relationship can still be quite caring with a technician. So they're not mutually exclusive. But if we're kind of keeping the lines clear, therapy on that end is really about the relationship. Almost all the research shows is that doesn't matter what kind of modality you're using, if it's CBT, DBT, whatever, the relationship that between the rapport between the client and the therapist is the most significant predictor of the counseling outcomes. So we know that that's really the meat of therapy, talk therapy. Neurofeedback, on the other hand, is not about the talking, except to get feedback to make changes. It's really about addressing the root cause in the brain of the dysfunctional nervous system, or other parts of the brain. Now, it's not to say that all root causes are completely and just about the brain. There's a second kind of brain in your gut that's important. People can have infections. There's other root causes. It's certainly not the end-all be-all. But when the root cause can be found in the brain, that the neurofeedback is able to address those root causes through kind of the Goldilocks principle of neurofeedback, not too fast, not too slow, with the neuron firings just right in the middle. And that person teaches their brain, it's very empowering, to be more calm, to be more regulated. And then the brain is like, oh, cool, that pattern's great, let me hold on to it. So the difference with neurofeedback is, rather than using the relationship to try to change the brain, which is not a one-to-one, at best it's repeated experience, but even then, I think for the most part what people find, and has been my experience as a clinician, is that talk therapy is supportive and important, the relationship is, but it doesn't address the root cause. It doesn't make the anxiety go away or disappear. It just helps you to cope better and use relationships as a support system for that anxiety. Whereas neurofeedback, done properly and in the right circumstances, really actually does teach the brain to make less anxiety, to have the brain operate differently so that you don't have to cope or get support. It's just much less or even gone. So that's how the two are different, but they actually end up working very well hand in hand. So there are clients who come to me and we start with counseling. I bring up the neurofeedback. They start doing that, and then suddenly the processing goes much smoother and much better, and suddenly they don't need me for the process. They're still seeing me for neurofeedback, either remotely or in person, and they know that I care. They know that that supportive relationship is there, but they don't need that all the time. And that's always our goal as therapists, is to work ourselves out of a job. And I find that neurofeedback helps me to do that much more efficiently. And then there's other clients who see an outside therapist rather than seeing me, and they're able to do the processing with them. But in the room, there's still a caring relationship. I'm still asking them how they're doing and what's happening, and can I make adjustments to improve the impact of the neurofeedback? So they actually, that relationship component, the talk therapy component, works very well with it. But sometimes when there's limited resources, we have to make a choice. And to me, more often than not, neurofeedback is my choice. I always say it's the most powerful tool in my toolbox, and I don't know how I'd ever go back to counseling without it. So that's what I've got for you today on that Q&A. If you've got some comments of your own, thoughts about it, please drop them in the comments. We'd be happy to talk more about it.